We're going to continue into learning about practice by numbers. I'm Laura from Front Office Rocks, here with Rohit from Practice by Numbers. And at Front Office Rocks, I teach, of course, front office teams how to get the schedule full and make it productive. But there's a step before that that's really important, which is cases presented and accepted. It's really important to know how you're doing and how the doctors in your practice are doing with presenting treatment and then getting it accepted. Practice by Numbers has some amazing information for us. So I'm going to hand this over to Rohit to show us how we can start to determine what we're presenting and what our patients are accepting for treatment. So Rohit, you want to show us what Practice by Numbers offers?
Yes, absolutely, Laura, and welcome back, everyone. The way we look into treatment presentation and acceptance is, again, same thing. Go into Practice IQ and click on Treatment Planning. Okay. When you click on treatment planning, a lot of things will start showing up. On the front page, on the first page, we show you the treatment acceptance per provider. So you can, now, when you have no providers selected, this is all providers, you can look at it for the all providers. But at the same time, you have to understand, how do we figure out how each treatment plan is allocated to a provider? And that's the key. Because most practice management systems, there's no way to say a treatment plan was presented by Dr. 1 versus Dr. 2 versus Dr. 3. So the way we figure out if a treatment plan is presented by Dr. 1 is we look for an exam or a consult code done within a week of the treatment plan or a week before, plus minus. If an exam was done and a treatment plan was done, we know the person who did the exam also did the treatment plan. Okay.
Okay, so I have a question about that, because we were asking about that in my office yesterday, learning this. So when we look at who put the treatment plan in, we use EagleSoft. So it does say which provider put the treatment plan in, but you're not pulling that in Practice by Numbers from that. You're pulling it from the exam code that happened, which doctor did the exam.
Yes, and also even in EagleSoft, and that's what we use in our offices as well, is EagleSoft, you put in who the treatment plan item is for, you still can't put in who's doing the treatment plan. And that's a limitation in almost all of the systems. And that's why we have to use some sort of a hint. And what we use is an exam code or a consult code, or for that matter, any custom code that you might have created, and you can tell us what that code is. That puts the treatment plan together with the provider.
Okay, that makes sense.
And in those rare circumstances that happen in every office, there is many times treatment plans created that there was no exam done, no consult done. And those fall into the unallocated bag category. And why does that happen? Let's say a patient comes in for a filling. There's a deep filling, and the filling turned out to be a root canal with a buildup and a crown. Now, in that case, the patient gets presented with a new treatment plan of a root canal with a buildup and a crown. And that day, there's no exam done, and if there's no consult done, we just don't know who that treatment plan belongs to. And it ends up in the unallocated bucket. So before you start looking at the treatment plan acceptance, you should try to see how much you can minimize the unallocated bucket. And for that, all you have to do is, every time you present a treatment plan to a patient, even in a day when you did not do an exam, just use a $0 consult code. Either use a ADA code, I think it's 9310, or create your own custom code and walk the patient out, or post that on that patient's ledger for the provider who did that treatment plan.
Okay, so for those like my office who's just starting to work with Practice by Numbers, we want to make sure we watch that. And our doctors do watch their numbers presented and accepted at the end of the day. So if there's anything in here that goes into unallocated, we want to make sure the right doctor gets a code walked out that will trigger it with Practice by Numbers.
Exactly.
Okay.
The additional things to look at, and we'll go into another video and we'll dig deep into provider level data. So there's a lot of information on this page, and here's the high level on how you take a look at this. When you look at this number, 32%, the treatment acceptance, I've selected all providers. What this means is the percentage of dollars that were presented that have been either completed or scheduled, okay? Say it in different words, if $100,000 was presented on 10 patients, and each patient scheduled $1,000 out of that. So in that case, the treatment acceptance would be 10,000 out of 100,000. So it will be 10%.
Okay.
But how many patients accepted? 10 out of 10. In that case, if I want to look at the details, the patient acceptance in that case would be at 100%.
Okay.
And those are two very important numbers to understand and differentiate, because you could have a problem on one versus the other side. Okay. And a bigger number and a more important number to look for is patient acceptance, which is what percentage of patients are accepting your treatment, any treatment.
Okay.
Okay.
So for offices who are trying to manage this number, like myself, if we don't put the whole, all of the treatments scheduled in, but there's still accepted some of the treatment, like you were saying, it'd be 100%. Are you recommending for the numbers to come out more correct that we schedule every appointment, or does it not matter as much as long as we know that we're getting a good percentage of patient acceptance?
So now that's a good question, and it depends on your practice. And I would say both numbers are important. Patient acceptance is important to see what percentage of patients are actually accepting the treatment moving forward, right? And that's a very important number to look at. But the case acceptance is important as well. So even if we have 100% patient acceptance, and you don't have only 10, 15, 20% of treatment acceptance, that's still a problem. Then you have to somehow change what you're presenting, because you're spinning your wheels, and maybe you're presenting a lot of treatment that's never getting accepted. So both numbers are important to look at.
Okay. So just an example. So if we were, let's say we're a practice that we were presenting on average $5,000 a treatment, or just say average, but the patients are only doing what the insurance covers, which is the $1,000. In that case, then the number, we would have a high percentage of closes, or we would have a high percentage of patient acceptance, but not a high number, dollar value of what we're accepting, because they're only doing what the insurance covers.
Right. And that's a good way to take a look at it.
Okay. So, and then the next thing I want to mention about this, as I'm starting to implement this in my practice, and with any systems that you have in your office, what you need to do is make sure that everybody's doing it the same way. So if you're going to have your patients appoint for all of their appointments, let's say they accept the entire treatment plan, then everybody on your team needs to do it that way. You can't have some people doing it one way and some people doing it another, or it's going to skew your numbers, because numbers coming out of practice by numbers is only as good as what we put in.
Exactly. And eventually they will normalize, they will equalize, especially when you're looking in the past, right? Yeah. So if I go back and if I look at numbers in the past, let's go back a couple of months. So now a couple of months ago, this number was much higher. Okay? And part of the issue maybe was that one setting in EagleSoft that we mentioned, that had something to do with this as well. And I'll create a special video after we are done over here to show how and what settings need to be turned on or turned off in EagleSoft for that number to make sense.
Okay.
But if you look into January and February and going forward, you will see that number will start to normalize. So you'll know what your acceptance rate is.
Okay. And like we mentioned in other videos, what's important about pulling in data like this is that the idea isn't that you're bad or you're not doing great. It's to figure out where you are, so you know where you need to improve, because there's so many things that we have going on in the dental office, and we need to get down and go, all right, well, how is our case acceptance, and where are we now? And as long as we're making strides in the right direction, things are improving in that area, that's great. It's just that a lot of offices don't even know where they are when it comes to case acceptance, or where they are when it comes to, patients going inactive or new patients coming in. So in order to keep these videos at a reasonable amount of time, because we know everybody's, going to be watching snippets of them, do you have anything else? We're going to do all of these in videos. Do you have anything else in this area that you want to mention before we end this video?
Yes, one more quick thing, but I won't go into the details of that. Is to also, there's in treatment acceptance, it's good to see what kinds of treatments are getting accepted. Okay? In terms of types, for example, in this particular case, how much did you present in restorative major, and how much it got accepted in restorative major, to see if you have a higher percentage or lower percentage in certain types of services. But then there's also important to look at what different treatment acceptance rates for different types of patients. Do you have higher rate in new patients versus existing patients versus emergency patients? And if you scroll down further in this page, it'll split it up based on what's the rate in new patients, what was the rate in recall patients, and what was the rate in emergency patients.
Excellent.
And there's different schools of thought on how to present treatment on these different kinds of patients.
Excellent. And my point on this, a couple of comments just to make on this is, we're not showing it here, but this can be broken down by provider, which is great because now you can start to see how the providers are treatment planning and how well they're doing at case acceptance. And I love that you can do this, in a month period or 6 months or a year or whatever. Because as you start, a lot of doctors like to go get more CE. I know my husband and partner, they go and they get a lot of CE, and when they come back, they want to be able to show that they're getting case acceptance at the higher level, that they're presenting more treatment. If you go to implant training, are you presenting and getting accepted to implants? So there's so much data in here that's going to help you on an individual level and at a higher level when it comes to running the practice. So this was just our intro to show you that you can't, you don't have to present the treatment, run and hide, cross your fingers that the patient's accepted it. Now you can really monitor it and see how your case acceptance is broken down by so many small levels. So we're hoping that this gets you excited to jump in further into practice by numbers and see what you have really going on in your practice. So thank you for joining us today.
All right. Thanks, everyone, and we'll be back.